Hi, welcome to Consult with a Professional. I'm Jesse Newman, and we're sitting here in the beautiful Bibliothèque, the library of the newest hotel in Palm Beach, L'Auberge de France. And I have with me as my guest Dr. Fred Barr, board-certified plastic and reconstruction surgeon. Fred Barr is going to discuss with us what many people haven't really are aware of, that most plastic and cosmetic surgery in America have been almost 90 or 95% for women. And it's just beginning to be recognized that men, too, are getting interested in looking better. And how significant it is that when we walked into this library this morning, on the coffee table were photographs on magazine covers of Cary Grant at this young age, and Cary Grant just before he died, and how the change is so obvious. Now, we're not asking Dr. Barr to tell us what magic potion is used, but from a scientific standpoint, I think, Doctor, why don't we start by a little history of facial surgery, and let me hear some of your expertise. Welcome.
Thank you. Thank you for having me here, Jesse. The field of plastic surgery is, as most people know, very broad. Cosmetic surgery is a small percentage of the total field, and most of us who do practice like the challenge of the different various aspects of our field, cosmetic surgery being one of them. In particular, it's interesting to note that this observation that you've made and others are making, in that the male now is wanting to look well, better, not necessarily more youthful, but wanting to look as well as they can. And this is something that has been seen to be on the rise. Percentage-wise, what you're saying is correct. The different categories, the different studies have shown perhaps maybe between 4 and 7% of an individual's practice of cosmetic surgery may be involved with male cosmetic surgery. The history in this country really dates back to the 1900s. And as far as facial surgery goes, probably there are two people that are involved in the early 1900s, both of them American, that have advanced the whole technique of facial surgery. From there, many, many different people have contributed and still are contributing. There are many, many variables involved. There are different techniques, but basically we all stand on the shoulders of giants before us.
Well, doctor, tell me, we know that aging process is inevitable. It's going to happen. Is it psychological that a man must accept it? We know that women won't accept it. We know that women start thinking about it as soon as they see the first wrinkle around their eyes. They start thinking about, will my husband someday be able to afford plastic surgery? But it's so noticeable today in all magazines. We see more men models, for example, than ever before. We see fashion showing it, while in years past all we saw were fashions for women with models. So I think that the professional man is very interested, especially attorneys who have to be visible in courtrooms, especially people who are people's persons. So tell me, in the aging process, where do we begin?
The aging process begins before you're born. Studies have shown that the aging process is a cyclical phenomenon. There are periods of growth, there are periods of development, and then there are periods of aging. Not necessarily does everybody age on the same biological clock. The factors involve genetics, which come from your parents. It involves your environment, which produces sun damage and abuse to your system. It involves what you do, such as smoking or excess alcohol, and it involves your emotional status. All these factors play a role. Even the fact of living in different climate areas. People seem to have a different aging cycle when they live in a four-season climate versus living in a temperate, hot climate. So there really is no variable that we can specify. All that we can say is it is a cyclical phenomenon. We don't really have a good tool to determine who will age at what time period and who will not age at what time period.
Do you think the factor of where they live is important as compared to perhaps their diet and nutrition?
I think all factors are important. I don't think that you can take one out of conjuncture with the others out of context. You have to look at all of them as playing a part. If you have somebody who strictly is on a diet but yet spends all their time in the sun, you're going to have factors of the sun damage that will not be controlled by diet alone.
Now, motivation of somebody making a decision. How, in your experience, have you seen people motivated to actually go in and say, "Doctor, look at me, I'm thinking of my eye lift, my chin lift, or a tummy tuck." But so tell me, what motivates somebody?
Well, I think what we have to look at is, just as you were saying at the beginning, what are we about? What is your appearance? What is your mindset? What is your profession? How do you view yourself? And these are factors that are very, very important in our evaluation of the prospective patient. Patients that come in that say, "I have to look better because my wife or my husband says that this is what they expect." It's a very big warning signal. This is something that we have to be very careful about, because surgery does have risks and complications. And as much as we make them safe and we do our best, and we do an excellent job on doing a good surgical technique with the least minimal complications involved, but it is still surgery, and people have to understand this.
Now, Doctor, I'm sure there are many women watching, wives of professional men, and this subject is strictly cosmetic surgery for men. Do you think that many of the women would have a problem suggesting to their husband, "Honey, you know, why don't you do something with your face? Pick up your chin, and your eyes are getting old. I don't want to be seen with an old man." How does a wife bring up this subject without getting into a domestic argument?
If you can give me the answer to that, Jesse, I'll be happy to tell all the... I don't know what the answer. I think that what has to be is, in anything else, in a good, solid relationship, if there's open communication between husband and wife, it works both ways. I think a frank discussion, I think, not in a serious vein, but in serious enough to where if something is suggested and you're willing to at least venture forth and find out what your options are, I think that that's a positive framework to put it in. Doesn't mean you have to sign a contract and say that by such and such a time you will have this or I will be gone. I think an honest, open, frank discussion, let your feelings out just as you do with other buying a house or whatever other important things in your relationship that come along.
Now, when you do this work, Dr. Barr, can you classify there's more nose jobs or eye work or chin work? What really is the #1 request when it comes to a man asking for plastic surgery?
The studies that I've read basically say the same thing, which is the eyelid surgery for the male and for the female are the #1 surgical request that most of us see. It varies from place to place, it varies with the individual, but I think that vision plays a role in this. There are some people that have visual difficulties, but then there are others that's what they notice most. They see that and they go from there.
Is there any special time in life where a man should start thinking of it? Does it have anything to do with his career? When he does it, does he have to think that perhaps 10 years later he's going to have to do it again? I think all these things run through a man's mind, perhaps more than a woman, because a man is maybe not as vain, yet needs the necessity of having it done. So is there any special timing in his life to do this?
There is no special timing. As far as, again, what this amounts to is an honest, open discussion, not only between the husband and wife, or if the man or woman is single, but with the physician themselves. There has to be a two-way dialogue. This is a prospect that is not only what the patient expects, but also what the physician can provide the patient. And therefore, it has to be put into context. If a patient has a certain area that they want to explore and see what options are available for them, then this must be done with the doctor, and it must be done in an open, frank manner of where the pros and cons can be dealt with, and then a decision can be made.